Hello out there, my nursing community. Today we're going to talk about the nursing process. So this is something that you're probably really familiar with right now. Actually, let me change that color. Something you're probably really familiar with currently in nursing school, and we see this when we do things like nursing care plans, the dreaded nursing care plans that everybody dislikes because it takes up so much time. But there is a real benefit to understanding the nursing process and the importance of a nursing care plan and what that really means. And specifically, if you can take away from a nursing care plan that it really is forcing you strategically to look at the step-by-step process in patient care and expected outcomes, and why it is you do what you do, and why it is you expect to see what you see, this is something that actually helps build your critical thinking. But we're going to talk about the steps in the nursing process, which are the steps that you actually would use in a nursing care plan, and what they mean. A lot of times we get a little bit confused about the steps, what they are, what they mean, what's really happening in this area. So the first part of our nursing process, I'm going to put right here, assessment. And now assessment is really just the data collection. It's you collecting all the information through physical data, physiological data, asking questions, the way you communicate, what you observe, what the patient is saying to you, what the family is saying to you. So this is going to be your actual collection part. And this happens here. So remember, when we talk about assessment and we talk about data, you're thinking about vital signs. You're thinking about the interview questions, right? You're thinking about subjective and objective findings and gathering all this information. The idea of this is to find out what the problem is, right? Or even what the problem can be. The second part of this is going to be your nursing diagnosis. So what's your nursing diagnosis? It's you formulating or putting a name to what the problem is that you have identified based off of your assessment. So you are going to formulate a problem. Now, this problem, saying this is what's happening with the patient or the family or the community, is based off of a couple of things. If they have an actual, something that is present and current and happening right now with the patient, or maybe they have a risk, which would be our potential. And we actually, I'll put in parentheses, have a third one, which would be wellness. And that's something different. We'll describe that in a minute. Now, an actual nursing diagnosis is saying, what is the problem right now with the patient? So as an example, if the patient comes in and they're having an asthma attack, right? And you identify the problem is that they have ineffective breathing. So ineffective breathing related to, because we have to have an actual etiology, right? Related to exacerbation of asthma. The ineffective breathing is an actual problem. Why? Because it's current. It's happening right now with the patient. So this is a problem right now. A risk is saying what the patient could be at risk for secondary to whatever problem that they're experiencing. Something that you can anticipate can occur that they're going to be at risk for. We could say this patient is at risk for hypoxia secondary to ineffective breathing. Doesn't mean that it's happening right now with the patient. Their oxygen saturations, if we measured it, could be fine. Let's say that they were 92, so they're okay right now. But if this issue is not resolved, or if it continues, we can anticipate this is a potential problem. Now, wellness diagnosis is a little bit different because it's on the side of the patient is doing well, right? They've recovered and now they are ready to take charge of their health. So let's say, for instance, a patient had a pacemaker that was put in. And so we're talking about now that enhanced cardiac output related to pacemaker insertion, or enhanced self-care related to increased cardiac output. So that more on the side of saying that the problem has been addressed and now the patient is on the road to recovery. Now the third part of this, the third part of this is going to be our planning. The planning means exactly what it sounds like. Going to go ahead and put together a process of how we're going to help this patient to get to where they need to be, right? So we've already assessed this patient. We've collected all of our data. We've discovered what the problem is based off of all of the data that we've collected, and we've created some nursing diagnoses. Now we need to look at these nursing diagnoses or these problems and decide, how are we going to fix it? So this is going to be our guide. This is going to be, what are we going to do to fix these problems, to get this person back to wellness? Now this is going to include our interventions. So let me put that here, intervention. And now our interventions are really going to be our action. What is it that we're going to do? What are we going to do to address all of these problems to get this person recovered, if we will, or back to wellness, right? Because that is the deal. What are our actions that we're going to put in place? What are the activities that we need to do? And that's going to be our next step, which is our nursing intervention. So let's put that here and I'll abbreviate it. Nursing interventions. So here's going to be our actions. So what are we going to do? So what are we going to do? Now that we have all this information, we know what's happening, how are we going to fix it? Now, in order to make sure that we really have fully supported nursing interventions and we're not just making up stuff off the fly, we need to have some type of evidence-based research to say that by doing this action or by carrying out this activity or by collaborating with these people of the healthcare team, this is going to help solve the problem because. So we need to have the support on why we're going to do that. So think of your interventions as the actions. And that could be things, as an example, like administering fluids, collaborating with physical therapy, increasing O2. All these things are actions, and they're things that you're doing for the patient in order to help to solve the problem, again, to get them back to wellness. That's the whole point of what we're doing here. And then the final part is going to be your evaluation. Evaluation is saying, all right, I've assessed the patient. I know the problem. I know the problem because I wrote them out in my nursing diagnoses. I made a plan to fix these problems. And I went ahead and I created all these actions and activities that I'm going to do inside of my plan to fix the problems. Now I need to evaluate if my plan has worked or not. So was it met or was it unmet? So we need to say, now, is this problem resolved or does it still exist? If the problem has resolved, then you've completed your entire nursing process and you've done a great job, right? If you've resolved the problems. If you have any things that are not resolved, then you need to do a reassessment. You need to re-identify what the problems are, and you need to make new plans and new interventions to make sure that those goals that you set, those achievable goals that you set for the patient to achieve so that they can recover and be well, are in fact met, because that's the whole purpose of the nursing process, okay? So there you have it. And this demonstrates a little bit to you the step-by-step critical thinking process of why we do exactly what it is that we do.